Hi, Dr. Yass here. I'd like to wish all those who are suffering from chronic pain at this time a sense of hope that going into the new year, there is a chance that their symptoms can be resolved and their quality of life returned. At this time, as we look forward into the new year, hope springs eternal. For so many who are suffering from chronic pain, including the 22 million who are addicted to pain medication, and the millions of others who have gotten multiple treatments, multiple procedures, seen multiple practitioners, and were told there's nothing left that could be done for them. I want you to recognize that hope does exist, and it exists in the sense that there's an alternative. I realize that you have gone to multiple practitioners, different specialists, but they all seem to fall into the existing medical model that addresses pain primarily by trying to diagnose the cause of pain through diagnostic tests like MRIs and X-rays. And I am a fervent believer that these diagnostic tests are invalid. And if you look at the way they're done, clearly the presentation of a diagnosis is really achieved through the self-fulfilling prophecy that a structural variation is identified while you're having pain, because the test is always performed when you're having pain. So you have to kind of recognize that it's not going to be shocking that, say, somebody over 50, 60, 70, 80, 90 is going to find structural variations via an MRI, such as a herniated disc, stenosis, arthritis, meniscal tears. All of these type things exist whether you're 5 foot or 6 foot, whether you have brown hair or blonde hair, whether you have blue eyes or brown eyes. It doesn't really matter. These exist, and the only benefit to the medical establishment is that the test is always taken when you're in pain. So by identifying these structural variations at that time, they could say, see, the structural variation is the cause of your pain. But think a little bit about this idea. Let's say that your pain began 2 weeks ago. If they're to tell you that a structural variation is the cause of your pain, that implies that before the pain began, the structural variation didn't exist, right? Think of the logic. You have pain for 2 weeks. Oh, we found a herniated disc or stenosis or pinched nerve or a meniscal tear or a bone on bone or any of the things they're talking about. What they're saying is that if the pain began 2 weeks ago, and that's the cause of your pain, if you didn't have pain 2 weeks and 1 day ago, then you didn't have the structural variation. Now, what you must understand about all these structural variations is that they're slow and progressive in their nature, how they develop. Most of these things take years to develop, years, not weeks, not months. So if you were to have taken that MRI 2 weeks and a day, or 2 weeks and a month, or 2 weeks and 3 months, or 2 weeks and 6 months ago, you would find that the MRI result was identical to the one that was just taken the day you had it. These things didn't just develop, they've been developing. They'll be there before you have pain, during the time you have pain, and after you have pain. The whole scam of the mechanism is that it's always done while you're in pain. Therefore, I can make the correlation that the structural variation is creating your pain. That's why you get treated for those structural variations. What's important to understand about the correlation nature is that it is considered junk science. There's no scientific rationale that it actually is correct. And the easiest way to understand this is an analogy where I open my front door just as dawn is rising, and then tomorrow I open my front door just as dawn rises, then I open my front door just as dawn rises, and I do this over multiple weeks. I can now say that me opening my front door causes the sun to rise. That is the same insane rationale that says that just because a herniated disc was found when you're in pain, that it's causing your pain. This is what we need to understand. This is going to be your understanding going into the next year, which is going to make you step away from the existing medical model and recognize that the Yass method, which is, as far as I know, the only method, and I am the only medical practitioner that has actually come out in complete reversal from the existing medical model. I want to abolish it. I don't want diagnostic tests to be utilized as the primary mechanism for diagnosing the cause of pain. It's insane. The Yass method is based on the methodology of interpreting the body's presentation of symptoms to identify what tissue is eliciting those symptoms, because every tissue elicits very specific symptoms. So by understanding the symptoms, you can understand what tissue is eliciting the symptoms. Now, in 95 to 98% of cases, the cause is muscle. 95 to 98% of cases. And yet, muscular causes don't show up on MRIs, nor is there any medical specialty educated to diagnose these causes. So, good example. You're having a back muscle and spasm. You go try to get treated. An MRI is taken, identifies a herniated disc or stenosis. What do you think is going to be treated? No one knows about that muscle and spasm. They can't identify it and it doesn't show up. What showed up was stenosis or a herniated disc. They're going to treat the herniated disc or the stenosis. You know this. Most of you who have experienced this if you've already gone through the system. So you could get treated for that stenosis, that herniated disc, for years. And they'll just keep throwing stuff at you. The first surgery doesn't work, they'll go for a second, a third, a fourth. It'll go as long as you're willing to take it, and then they'll try an alternative. No. Why don't we try something else? Let's try radiofrequency ablation, which is cauterizing your nerves, or rhizotomy, severing your nerves. Eventually, you'll probably end up on pain medication, which is the last-ditch effort to try to mask your symptoms. It's basically the medical establishment putting their hands up and saying, we give up. We're no longer going to try to establish a cause. We're just going to try to mask your symptoms for the rest of your life. Or you're in that horrible group of people who were told, we give up. We don't even know what to do for you. So you're just going to have to live like this. This is the attitude, and this is the system that encompasses not just this country, but the world. There's roughly 126 million adult Americans in the United States, and roughly 1 billion people in the world suffering from chronic pain. This is the system. I get contacted from all over the world, and the system is always the same. They found a structural variation, they're trying to treat that, and I'm getting no better. And I'm getting frustrated, and I'm becoming hopeless. Don't become hopeless. It is the new year. It is a time when most people look to try something different, to enhance their life, to make their lives better, to make the quality of their life be what they want it to be. In the area of treating chronic pain, you have one hope. It's the Yass method. It's that simple. So, instead of saying this year, I'm going to go to another medical specialist, I'm going to get an opinion from somebody completely different in the medical establishment, but it's definitely different than the medical specialty I went already. Don't anticipate you're going to get any type of different result, because they all generally follow the core principle that diagnostic test findings are the answer to the tissue eliciting your symptoms. You need to go completely away from that, and that is the Yass method, the only method that interprets your body's presentation of symptoms. Very, very specific. A bone, a muscle, or a nerve will create very specific symptoms. The Yass method is in a position to identify all possible tissues. Don't get caught up again, the medical establishment, oh, it's inflammation. Again, just nonsense. A heart attack is not inflammation. A kidney stone is not inflammation. A cut is not an inflammation. And guess what? In 98% of cases, inflammation is not present because you don't see swelling or heat where the pain you're experiencing exists. And that is what? The body's presentation of symptoms to indicate that inflammation is associated with your pain. Just look at yourselves. When you're having your pain, ask someone, or if you have the capacity to, look at the area. Do you see heat or swelling? If you don't have heat or swelling, inflammation isn't present. So anyone trying to promote that, again, part of the medical establishment. You have one chance, the Yass method. Let's make this year the year you find your path to the process that allows the proper tissue to be identified, the proper tissue to be treated, so that the cause of the symptom, the tissue eliciting the symptom, the distress of that tissue can be ended. And at that point, the body no longer needs to create the distress signal, and your pain simply ceases. It's really that easy. It is how the body works. So if you want more information about the Yass method, you can go to my website at www.mitchellyass.com or email me at drmitch@mitchellyass.com. That's drmitch at mitchellyass.com, or call me on my cell phone, 516-449-1359. If you've had surgery, if you've had procedures and you think that those are a factor in preventing the system from working, that's a fallacy, because any of those procedures, if they were done on the wrong tissue, still implies, if muscle is the cause, that the muscular cause is still there. That's why you're having your symptoms. So it still works. If you are concerned about age or functional level or anything, don't be concerned. This system has been utilized on patients from 6 to 102, all forms of functional level. And yet it works because it is a universal mechanism for interpreting what tissue is eliciting the symptoms. It's irrefutable. It is absolutely the way the body works. Now, if you want to contact me by phone, it is 516-449-1359, 516-449-1359. If you'd like to come to my office and get treated, just so you know, the office is in St. Augustine, Florida. It's about 30 minutes south of Jacksonville in the northeast corner of Florida. We can do Skype evaluations if you choose. If there's a difficulty in getting here, you want to try to do it through the computer, we'll do a Skype computer evaluation and treatment. If you're in pain or you know someone in pain, please get them to the Yass method. If you have a medical practitioner that's been trying to help you and they're getting frustrated because their existing education isn't working, let them know about the Yass method. We're also providing lectures to medical practitioners and their facilities, whether they're physical therapists, chiropractors, massage therapists, primary care physicians, I don't care who they are. If they want to understand how to properly diagnose their patient's pain and resolve it completely so they can get their back life, those are the medical practitioners I want to talk to. I want to help understand how to utilize this system. We'll find a mechanism to do so. So for all of you going into the new year, let's join together. Let's give everyone, I mean everyone, that chance to see their symptoms resolved and get back the life they deserve. I've treated people who were suicidal. I've treated people who have become divorced. I've treated people who have lost their jobs. This doesn't have to be this way anymore. I have people coming to me from all over the country. The message is getting out there. We need to keep pushing, both as patients and medical practitioners. Let's join together. Let's see the value in this, and that it basically is simply working in the way that the body really wants us to understand what tissue is eliciting that symptom. So let's all get together. Let's make this a great new year, and let's all resolve our pain and get back the full functional capacity you all deserve. For now, this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life and a fabulous, fabulous new year. Bye-bye.